believe everybody should talk about their heart with their primary doctor, because it is such a common problem that sometimes the issues are silent and they don't necessarily show themselves right away. And prevention is the key. So I think everybody should discuss their heart health with their primary doctor. The primary doctor will then evaluate the patient and decide that they're in good shape. You know, some doctors are more aware of cardiac problems. Some doctors are less aware. They probably can decide if they want to handle anything or prevention on their own, or send the patient to a cardiologist. So I think every patient should bring it up. Let's start with the patient that is active and they eat healthy. If they're active and they start feeling limited in any way, shortness of breath, fatigue, discomfort in their chest during activity, this is a big tip-off. This is somebody who needs to be seen by a cardiologist. If your lifestyle is such where you haven't had the time to exercise as much as you want, and maybe your weight isn't ideal, then it could creep up on you a little quicker. And again, shortness of breath, chest discomfort, those are big red flags. Palpitations, feeling like your heart is going fast or skipping a beat or racing. This is something that this is another red flag that should be looked into. I mean, everybody has what we call palpitations once in a while, but if they become more frequent and troubling and are associated, especially if they're associated with other symptoms like the shortness of breath or the chest discomfort, then yes, a cardiologist should be sought and there should be an evaluation. Now, personally, I view my patients as human beings when they walk through the door, not a victim of my tests or examinations that I want to do. I want to make them comfortable to start with, above all, and I want to find out what the problem is, not by knowing what other people have said, not necessarily by their lab values, which are very important, but by what the patient tells me, what they expect, how they feel, their fears, their goals. And then from there, we use that information to treat them the best way possible. I mean, not everybody needs to have open heart surgery, and not everybody needs to have testing at all. Sometimes their problems are not cardiac, and sometimes just by a simple conversation, we can decide that that is not the issue, and that they really, they're fine. They don't really need to go any further. On the other hand, some people want to be reassured by certain testing, and that's easy too, and that's what we discuss with the patient when they come in.